Hello and welcome to the webinar. My name is Katie Valesky and I will be acting as moderator for today's webinar entitled Consumer Involvement and Governance, a production of the National Healthcare for the Homeless Council with support from HRSA, Office of Special Population Health. This is a one-hour presentation with the last 10 minutes reserved for question and answer. I would now like to introduce you to today's speakers. Winona Stoltzfus joined the Albuquerque Healthcare for the Homeless program in 2010 as their executive director. She's a pediatrician, but has spent the majority of her physician career helping people access health care. Kristin Leve has been on the board of directors since 2007. She's also a past chair of the board of directors. She co-chairs their CBAC, which is their Consumer Advisory Board. She also chairs the Advocacy Committee of the board of directors and is very active in a variety of advocacy venues in the community. And Kristin has also been doing volunteer work with the poor populations and homeless populations for all of her adult life. We are delighted to have Winona and Kristin with us today. And I'll turn it over to Kristin to present the first portion of our slideshow.
Thank you, Katie. Hi, today we're going to be giving you an introduction to consumer advisory boards and how you can effectively have consumers in the governance of your agency. To give an overview, we'll be going over federal regulations, the information on consumer advisory boards, or CAB. We'll be talking about the National Consumer Advisory Board, also known as NCAB, and we'll be talking about advocacy and how you can make your voice heard. Starting off with federal regulations, Section 330 of the Public Health Service Act requires that your governing board is composed of individuals, a majority of whom are being served by the center, who as a group represent the individuals being served by the center. If this requirement is not met, a separate health center governing board may be established, which is your local CABs. Waivers to the majority rule can be requested and are available for your local agency if you do not have a 51% consumer-based board. Here in Albuquerque, we do have that. We have a 51% based consumer board for our board of directors at Albuquerque Healthcare for the Homeless. By doing that, we gave up our waiver and are now required to have the majority of our board be people who have experienced services, who are even currently homeless. The way that differs from what a lot of you may be used to is that we are a standalone agency, so we can make sure that our board has people who have in the past or are currently receiving homeless services on our board. A lot of you being connected to hospitals and other health centers, those health centers are the ones that have the board of director rather than just your HCH. And they may do it differently. If they do it differently, I encourage that you have a consumer advisory board to give your administration feedback on what the needs of the consumers are in your community. So if you need a waiver for that, you contact your federal representatives for that. And I'm going to turn this over to Winona.
So when we talk about ways to get consumers involved, this is where management has a very key role in supporting the formation of either a CAB or a CBAC. And CAB is a Consumer Advisory Board, and CBAC is the Consumer Board Advisory Committee that we have here in Albuquerque. So one is by including former consumers on the board, and as Kristin talked about, for most community health centers, there's a requirement to have 51% membership of consumers on the board. HCH projects can get a waiver, as she mentioned, but you still need to have consumer representation on the board, and we do that through our CBAC. Another way of getting consumers involved is to have focus groups with consumers, and they can advise the board on a regular basis, or the formal advisory board that we've been talking about, the CAB or a CBAC, or as this says, the committee of the board having the Client Board Advisory Committee. And back to Kristin.
Thank you, Winona. Okay, here is a picture of our CAB, one of our CAB meetings. And as you can see, you want your CAB to be a group of homeless and or formerly homeless individuals, advocates, providers, and community members who are brought together to positively affect change at your local level. We do this by not only having people that we have provided services for sit on our CAB, but also by putting the word out there to other local homeless organizations and asking them if they have any consumers of their services that would like to be involved on our CBAC also. The purpose of a CAB is to advocate for your clients and what they need. You also want to identify potential clients. One of the ways we do that locally here is our CAB participates in outreach, and we will go around and talk to people that we meet in the shelters and on the streets about services that we provide, and inviting them. We always actually, we invite people first for services. Once they get services and we see an interest in their, to be involved in other aspects, we'll reach out. But of course, our first role is to always make sure we're hooking people up with services. You want to nominate consumer representatives to serve or advise on the board of directors of your health centers. A lot of you get around that by being attached to hospitals or health centers. They may follow the 51% consumer-based board, but you have to understand that their consumers are going to be drawn from the entire health center, not just your HCH. What I would encourage you to do on a local level is to ask that someone who has experienced homelessness and received homeless services be able to represent your HCH on your health center's board of directors. And you also need to inform your board of directors and, of course, your administration on the current needs among the clients in your community so that we may better serve them. For membership, you want to have anywhere between 5 and 25 members. I personally have never seen one that high. We are generally around 10 people. I think we have about 6 to 8 right now. And of course, you know, the bigger your project, the more people you may want to have involved. But it tends to work really well when you have around 10 to 15 people, I think. You want them to be representative of your community. Of course, you want them to be clients or previous clients of your project and other homeless service agencies in town. You will need to provide staff for your CAB, and other agencies' staff are also welcome to participate. And I would recommend that you have either your executive director or one of your top-level management to staff your meetings. The reason I recommend that is because it gives your CAB a voice right away, rather than having to tell someone to tell someone else to tell someone else what is needed. You get that directly to the people who help make the decisions. You want to remember that your CAB is community advocates and champions, and that you will need to support your local CAB. You also want to know that at least 75% of your CAB should be current or former consumers, and that when you develop your CAB or your already developed CABs, that you have terms of memberships that should be outlined in your bylaws. For example, how many years you can serve on the the board, what your participation requirements are, what your conduct during the meetings are, service requirements, things of that nature. You want to remember that the work of your CAB must appropriately represent its constituents, your project, and people in your cities who are experiencing homelessness. We stuck this slide in here because it represents here in Albuquerque. As you may know, we're very well known for hot air balloons and our annual balloon fiesta. I picked this slide because I think what it represents is a homeless person being the hot air balloon. A hot air balloon does not fly on its own. It needs support. It needs a pilot. It needs a chase crew. It needs people who are going to set it up, watch it while it's flying, and help take it down when it's done flying. And you can see your local HCHs as being that chase crew, and your clients' providers as being those pilots. And to remember that our job is to support our clients in getting stable and getting housed so they can exit homelessness. And I just thought this was a really cute little slide. And as you'll notice, there are a lot of people standing around and watching. And I think you'll notice in your communities, there are a lot of people who observe what we do. And by educating and advocating, we can pull them in and have them be involved. Okay, this is talking about effective attributes of our CAB members. You want to have your CAB members willing to represent others, not just themselves. A very important thing to remember for your CAB is that you maintain confidentiality. The way we do that here in Albuquerque is we treat it as like a therapy group. What stays here, what's said here stays here. Sort of like, you know, what happens in Vegas stays in Vegas. And the reason we do that is so that we don't cross any boundaries and pass on information that someone may not want us to. We want to make sure that our members are open-minded and to go along with that are willing to compromise, because as you all know, unfortunately, we do have to do that in this day and age with the economy the way that it is. You want to be trustworthy, and you know, the agencies rely on the consumers for very relevant information, and I think if you encourage your CAB members to speak their truth, you're going to find that they are very trustworthy individuals. Remember that your CAB's role is to focus on your organizational mission, and that you can get that organizational mission from your HCH staff representation or director. And another thing that works really well is to be a good listener. At our CAB, we practice active listening skills. That means that we are listening to what others are saying, not thinking of a response to what they're saying while they're speaking. Any questions can be answered once someone has said what they wanted to say. There is absolutely no requirement for formal education. It's about life experience. And you're willing to share your experience and listen to and help others. The decision-making process, go ahead, Winona.
Hi, this is Winona. I'm going to go back just a moment so that we stay on the local CAB question for a bit. So one thing I wanted to point out to the participants in today's webinar is that management has a key role in supporting either the CAB or the CBAC, whether it's an actual board or whether it's a committee of the board. And it's crucial that management supports the CAB, because that's what gives the CAB the opportunity to flourish and really do what they're designed to do. So you might ask, how can management support the CAB? Well, they can do things like making a meeting room available, sending out information about when the CAB or the CBAC is going to be meeting. So here in Albuquerque, our CBAC meets monthly. 5 days before the meeting, we send out reminders to the program so that people can talk to consumers as they're coming in to remind them about the CBAC meeting later that week. We have permanent signage up that stays up all the time just to remind consumers. And then we also have something called Yard Reach, where we have staff members going out into the yard, into our courtyard. So the days before CBAC and the morning of CBAC, we're actively talking with clients to invite them to the CBAC that day. So again, the main point here is that management has a vital role in supporting whatever your CAB or CBAC is doing. And back to Kristin.
Thanks, Winona. And as I can say from personal experience here in Albuquerque, having management involved has been a wonderful thing, and we know that we're always listened to. So my recommendation for any of your organizations out there is to make sure, if your ED cannot be involved, which I highly encourage, is to at least have upper management involved. And the reason is because that way, when you have to get information to management, it doesn't have to go through a bunch of different people to get there. So I would encourage on the local level, if your ED cannot be involved, which I highly encourage again, to have upper management involved staffing the meeting. And that way there's direct access to information in both directions. Okay, on the decision-making process. The NCAB uses and recommends consensus as a model in your local CAB, and that's, basically everyone agrees, and you move forward. The basics of consensus is to listen, of course, patiently. Make sure you're focusing on the topic at hand. Of course, you should go into your meeting with an agenda and try to stick to it. It's not always easy. But it's easier to deal with one topic at a time. You have a presentation of the proposal that is forward, and you have options. You can affirm, not affirm, stand aside, or block. The proposal is approved or not, and all voices are equal to that of the majority. And then you can also use Robert Rules of Order if the consensus doesn't work for your CAB. And I'll tell you, the way that we do it is sort of both ways. We use Robert's Rules of Orders for things like going over previous meeting minutes, things like that. And then when we're talking about different topics, we're not so strict about it. We will use consensus for that. So we kind of go back and forth, and you can do what feels right for your CAB. The way that we have, or you can choose to one over the other. Here's another picture of one of our CBAC meetings. Threw that in there. So more of our CBAC members. And this takes place in our South Community Room, which is the main meeting room at our HCH. Okay, moving on to consumer advisory boards. To remember that your CAB is an advisory group. And this is how most of your CABs will be different from the way we do ours here. With our CAB being part of the board of directors, we aren't just an advisory group. We are actually participate in program and policy. You need to make sure that your CABs are working closely with your management and staff. Most CABs do not make decisions on day-to-day operations of the agency. Here in Albuquerque, where we are different, is that we do have input on day-to-day operations and can affect the outcome of management decisions. You do want your CABs to provide insight on how your agency's policies and practices affect your consumers. And I think that's one of the most important things that any CAB can give to its agency, is to let them know that how their practices on a day-to-day basis affect what their consumers go through. Your consumer advisory board should be autonomous. And if you do not have, like we in Albuquerque do, a 51% base consumer board, we're striving for that, your cab needs to be autonomous. Ours cab is not, because we are a committee of the board of directors. What you need to do to support that consumer advisory board is to allow it to make its own decisions and recommendations and develop its own guidelines, bylaws, rules, etc., which can be approved by the agency's board of directors. We just finished a rewrite of our rules, bylaws, and we'll be bringing it to the board of directors this month for our final approval. The National Consumer Advisory Board for the National Healthcare for the Homeless Council is, like any of your cabs, a group of formerly homeless people who have been your clients and would like to be involved in the governance of those projects. NCAB elects a chair to sit on the National Council's Board of Directors, and all members of NCAB are individual members of the council. Your cab can easily be a member of the National Consumer Advisory Board by going on the website and signing your local cab up. Okay, the National Cab's roles with the local cabs, as you can see, the NCAB advertises and facilitates involvement in national activities, and there's many ways to do that. One is to participate in our National Homeless Persons Memorial Day. A lot of HCHs across the country have a National HCH Day, and also participating in consumer participation outreach surveys. The second role is to honor those who advocate for the needs of their fellow consumers. One of the ways that that's done nationally is with the Ellen Dailey Consumer Advocacy Award. It is awarded every year at the national conference, and you can find applications for that award on the NCAB website, and if you would like to honor one of your local consumer members. The National Cab also offers travel subsidies to the national conference of up to $1,000 on a first-come, first-served basis. The third role is to support and facilitate communication and collaboration between your cabs regionally and nationally, and that there's a regional representative in place to share information about the national initiatives as well as local activities that you can be involved in. And then it also sends project information to the NCAB for national collaboration. Okay, here we see under the NCAB's roles with the local cabs, the first point that we talked about. One of the things that we do here, we are heavily involved at our local level with the National Homeless Persons Memorial Day. We have a great thing here at our agency. We have a memorial wall out back, and attached to our agency is a art studio, and every year we get a list of the people locally who have passed away in the previous year, and we make tiles for them, and then they're added to the wall every year. We also have a rally and a march that proceeds to a local church where we have our memorial service. It's a candlelight service. If your local agencies don't participate in this, I would strongly recommend that you do so. It is a great way to bring your community together. Ours is attended by pretty much everybody who works with the homeless here in Albuquerque, and many of our homeless consumers who are still homeless, and of course people like me who were homeless and are now housed. And so it's a really great way to remember why we're doing what we're doing, so that we can work to make that number of people we lose every year 0. As you can see, the Memorial Day falls on the first day of winter, and I know across the country everybody tries to have that during that week of the first day of winter. So ours is generally the 20th, 21st, 22nd of the month, depending, of course, on when that day falls. This last year, we actually held it on December 21st, and that doesn't happen very often. So, okay, moving on. This is some pictures from a couple of the agencies across the country and what they have done for their National HCH Day last year. Another way for your CAB to be involved on a national level is to participate in the Consumer Participation Outreach Survey. The last one that was done in 2010 was a violence study. And you work with the NCAB chair and Amy Grassett, who's a principal investigator, and they presented the results of the study at the American Public Health Association in October 2011. All of those survey results are available on the NCAB's website. If you're interested in participating or hosting a study site, please contact the National CAB at their website. If you have an idea for future topic ideas, that's a good place to take it to. Okay, under the second point, you see those national, I'm sorry, I keep saying a lot, those national opportunities for your clients to be involved in. Of course, the biggest thing that we do every year is the Dailey Consumer Advocate Award. For those of you who have never heard of or didn't know Ellen Dailey, she was an NCAB member, and she also sat on her local board of directors. She was involved for many years, and I can tell you from personal experience that she was just a really wonderful lady and was very passionate about the work that she did and making sure that she helped consumers come out of homelessness and live productive lives. And I did get to meet her once, and it was a really great meeting. It was the first conference that I ever attended, and we just had a really wonderful conversation. And of course, the following year she passed away, and I was very happy to see the NCAB come up with this award to honor her. So if you have any ideas for any of the clients from your HCH that you think has done an outstanding job advocating for the homeless, participating in the CABs and the governance of your organization, go to the NCAB website and you will find applications, and you can submit any one that you want for the award. And then, of course, the travel subsidies are covered on a first-come, first-served basis. So this is what the award looks like. As you can see, we add names to it every year, so it'll be interesting to see who wins the award this year and whose name is added to that board. And of course, under the subsidies for the conference, this year's conference will be in Kansas City, May 15th through the 18th. And I'm looking very forward to it. I'll be presenting there, and then of course participating in the consumer stuff with the conference. For any of you who haven't been to the conference, I highly recommend going. It's a really wonderful time. You will learn a lot, and your consumers will get so much out of it. I know that me personally, when I got involved locally, and I realized that locally people listen, that made a big impression on me. Then when I got to go to the national conference, and then I realized that not only do they listen locally, but they listen nationally, it even boosted my confidence more. So I highly recommend taking your clients to the conference. We love having as many clients from across the country as possible, and we do really great networking, sharing of information at the conference. Plus, there's great workshops, and you learn a lot. Okay, and then of course on the third bullet, I'm going to go ahead and pass this over to Winona.
Thanks, Kristin. So another role that NCAB has with the local CABs is to support and facilitate communication and collaboration between the client advisory boards both regionally and nationally. The National Council does have regional representatives in place who can share information both about national initiatives as well as learning about local events. And you're going to notice again the theme that we talked about earlier with the reciprocal communication. It's national helping local CABs and CABs also advising the national level. So please, to help facilitate this, ask your local CAB or CBAC to send project information to the NCAB so that NCAB knows what's going on a local level. And here you're going to see a map that has the different areas represented on it. And I think, Kristin, you wanted to say something about having people look at the map and see what region they're in?
Yeah, take a look at the map and find out what your region is. Every region has a representative, and Katie can help hook you up. Their National Council can help hook you up with your local representative. I would also say that for some of you, across the country, there are regional National Healthcare for the Homeless Council conferences, and the great thing about those is that you get to meet people from your region, and as you may know, you often find that these regions are set up and weather is very similar in a lot of these regions, and so you'll find that the regions help you understand more of what you're dealing with on a local level, because the regions are set up so that all of the states represented are dealing with similar situations. So, and you can see at the top of that slide that there is a list of who the representatives are for each of the regions. Regions are covered, more than one region is covered by a representative, and they are local in your region. So, okay, now we're talking about advocacy, which is really the best part of what we do. Advocacy is the educational process through which data, experiences, and insights are shared with those who craft public policy so that they may make informed decisions. The way we do that locally is to make sure that our needs are voiced, whether it's through working with the mayor's office, city council meetings, local meetings that have to do with any state level legislation. You'll find, I'm sure, in your states that any time state level stuff is going through, they'll have meetings in your area to get feedback from their constituents, and those are great opportunities for your CABs to be involved in letting your state reps know what is needed locally and what they can support so that we can get our clients what they need. Go ahead, Winona.
Thanks, Kristin. Another example of advocacy that we do here in New Mexico is each year while our legislature is meeting, we take a group of clients up with us to have a lobby or an educational day at the legislature. And those of you that have gone to national conference know we often have rallies, but I just wanted to talk about how this can happen locally or at the state level. When we go up to our legislative, our rotunda, our clients are actually meeting directly with legislators and talking to them about bills that are being presented in the session. So there's direct interaction and there's direct advocacy. And again, I think this is another way that as management we can support a CAB by helping people who are homeless or people who have left homelessness. We can help them have a voice and empower them to advocate for themselves. We're going to be going through some other examples of advocacy, and I'll turn it back over to Kristin now.
Thanks, Winona. And just so you all know, here locally last week was our annual lobby day, and a bunch of us, not just from HCH, but from our other homeless organizations in town here in Albuquerque, drove up to Santa Fe, our state capital, and you get to track down your local senators and representatives. We go informed about the bills that we want to talk to them about, so we can give them any information they can. Honestly, this year we didn't ask anybody for extra money. We just asked that they kept our funding streams the same, and so we would not lose any money. It's not easy work because you do a lot of running around. We have our capital is called the Roundhouse, and so there's a lot of up and down stairs and back and forth between office buildings. So it's a little more involved than, say, lobbying on the national level in D.C., because at least in D.C. you know where they're going to be and you know who you're meeting with. When you do it on a local level, it's a little more difficult. You tend to be running around a little bit. But it's really great because the most important thing that we do with this is to educate our representatives on what the needs of the homeless community are and what bills are out there that will best support the work that we do. Here is a picture of our memorial wall, and so this is one of our local projects. The wall is actually about twice that size and 4 times that size. Yeah, it's pretty big. It's getting bigger and bigger, unfortunately. But there are many artists represented on here, and I can tell you that there's a couple of tiles I can see on that wall that I actually made myself. So, and it's really a great way to honor your local community, and it lets the friends and family know that we don't forget our people. We are not only doing the work that we do to help the people on a daily basis, but we do it in remembrance of the people that we couldn't help and that were just as worthy of our help as anyone else. The greatest thing about your cab is that they can really give homelessness a voice, and advocacy is the best way to do that. And that the best way you can advocate is to support, protect, and advance civil and human rights of people experiencing homelessness. And that is through housing, through health care, through things like food stamps and food boxes. I mean, it just goes all over the place. And your organizations do a lot of that work, but the CAB can really be the backbone of how you do that work. The more people you have to tell their stories and who can say, this is exactly how what you're doing affects my life, the better. And you have a really good chance to influence public policy and practice and create change in your own community so that homelessness is an issue that sometime in the future we hopefully will not have to deal with. And one of the projects that our local CAB worked on, this is our organization, the front door of our organization. As you can see on the front of the building, there's that really wonderful sign there. And you can also see a bunch of trees around. And the last time I saw this picture, I noticed someone had their laundry hanging up under one of the trees in our courtyard. We were able to get new signage put up at our organization through our CAB, and the company did a wonderful job. And not only did we get that amazing sign that you see right there, but there are signs everywhere in the agency. They labeled every door. even the utility closets have little name tags on them. And we have a great, if you will look off to the left, you'll see sort of a black sign with a white interior. That's a map for the whole organization, and it says exactly where you need to go for what you need to do. And then, of course, the new trees we were able to get. We already had some trees, but we recognized that here in the summer it gets really hot. We need more trees in our courtyard because we can't fit everybody inside all the time. So plenty of people will wait outside for a medical appointment or something like that. So we wanted to bring more trees in so we can get a nice shady courtyard. The new trees, of course, have wire wrapped around them so people won't mess with them, and apparently that day that the picture was taken, somebody was trying to dry their laundry. We don't see that all the time, though. So in the next slide, you'll see our advocacy activities, and you'll see that we promote the advocacy agenda in your local community, state, and congressional district. Last week we had a little rally after we were finished chasing down our legislators, and we had 2 senators that spoke at the rally. It was a really small one, not a lot of people there, only about 30 people, but we were really able to let people know what we're doing, why we're doing it, and why the bills we were up there to support were so important. You can also conduct consumer needs assessments in your clinics. One of the ways that we do that locally here is that once or twice a year we will do a local survey just for our own information, and we'll ask questions like how are the hours, how are you being treated by staff, those kind of things. And if you're interested in doing something like that, you can email me, and I can get you an example of one of our previous surveys. We basically came up with the questions on our own. We didn't take it from any national survey. We just sat down in our cab one day and decided, okay, what do we want to know from our clients? And made up a very short survey of only like 8 questions. Of course, it's an anonymous survey, and the support that you will need for it is to have your CAB members involved in doing things like going to the medical clinic with surveys and sitting down with people maybe while they're waiting for their medical appointments and going through it. It only takes like 5 minutes because it's very short, but that's something that you can do locally. You can organize an advocacy day or an HCH day. Some of you may do the HCH day across the country. We don't really have an advocacy day here. What we do is split our advocacy up for different things, like our lobby day. I recommend that everyone invite your local public officials to your clinic. One of the ways this year we're going to do that, we've done it in the past, although not in the last couple of years, we are going to have an open house at some point this year. We haven't completely got it figured out yet, but it'll be in the evening after hours. Your whole staff does not need to be there. The more consumers who are there is better, and you invite local, state level, even your national reps to come. So you might want to, if you do schedule tour or an open house, check and see when your senators and representatives will be on break to come home, and maybe set it up for when they're home so you have a better chance of getting them there. We here in Albuquerque also offer official tours the second Tuesday of every month, I believe. No, not the second Tuesday.
Yeah.
Is it the third Tuesday? Yeah. And they come down and meet with someone, and they give them a tour around. Those are for, local business people that you may work with and stuff like that. So those are some ideas that you can do to work with your officials locally, state level, and federal level. You can also distribute what's called the HCH Mobilizer, and if you're interested in that, look on the Council's website. Organizing a Homeless Persons Memorial Day event. If you don't do that, I highly recommend doing it. It's something that is really important here to us in Albuquerque, and we are able to, and I don't think most of you would be able to, but we are able to close our organization for the afternoon and have all of our staff present, and they all come, so it's a really big thing. You also want to think about attending town hall meetings and collaborating with other local service providers. This is something we participated in. We're going through a state-level Medicaid redesign, and last fall we had a local meeting here in Albuquerque, and all of our CAB members were present at this meeting. Oh yeah, I'll go back to that right quick. The man who you see speaking at the podium is our medical director, Dr. Matt Vega. He's a great guy. And this, of course, is the rally in D.C. at Union Station. And you will be able to see how we do that on the national level. If you go to the conference in Kansas City, we'll be having a rally there. So I will turn it back over to Katie.
Thank you so much, Kristin and Winona. That was a wonderful presentation. Really appreciate your time today. I wanted to take a moment and answer some of your questions, and please keep those coming, and we'll answer as many as we can. The first question is for Winona. Winona, how do you fund supporting the CBAC there in Albuquerque?
So thanks for that question, Katie, because I know that's something that comes to everybody's mind. And the answer is there's minimal cost involved with it. The CBAC meets here at our facility and uses, a meeting room that's readily available. So there's minimal cost involved, and any costs that are involved come from the board funding stream, because this is a function of the board, of our board of directors. But the main answer is there's minimal cost. Then if we have consumers that want to go to the national conference, we apply for the scholarships for them.
Thank you, Winona. Kristin, the next question is for you. Are the meetings of your CBAC open to consumers? You mentioned recruiting people out in the courtyard. Are those open meetings?
Yes, they are open meetings. We have signs up around the agency that invites people to come to our meetings and the time and location of our meetings. So we will get people through. Not everybody stays or ends up participating in CBAC on a regular basis, but our meetings are always open, and if we're going to have any guests, we always make sure one of our staff people know if there's going to be extra people. So.
Thank you very much. And Winona, the next question is for you. How do you recommend accomplishing homeless consumer input in the sites that maybe have mixed funding?
So if they can use the CAB or the Client Advisory Board model and just set up facilitate setting up the Client Advisory Board. Is that what you're asking, Katie? I just want to make sure I'm answering the question.
I think that might get to the question. Yeah. So you would recommend setting up a homeless consumer advisory board in those
right,
sites?
Exactly, and management supporting that. And the other thing that I wanted to point out that we were talking about earlier about federal regulations, it actually is a federal regulation that for agencies where it's like a Health Care for the Homeless project associated with another agency, it's a requirement that they have someone who is experiencing homelessness be on their board or representing that community on the board. So you can get a waiver where you don't have to have the 51% consumer participation if you're an HCH project, if you're a pure HCH project, but if you're not, you do need to have that representation from the homeless community on your board, and not just a consumer.
Okay. Thank you for that clarification. I'm sure there were some
sure.
Other folks who didn't ask that question that have those kinds of situations. Well, that's all the question and answers we have for today. Would like to offer these resources, and we've mentioned these, Kristin mentioned these several times in the meeting. You can go to our website, www.nhchc.org/resources/consumer, and access the following resources. You can join NCAB. Membership is free. And so no reason not to do it. And you can stay informed of what local CABs, the National Consumer Advisory Board, and other events that might be going on. You can nominate someone for the Ellen Dailey Award. That form is up live on our website. You can download the CAB manual to help you get started on your CAB. Of course, we're available for technical assistance if you need more information or that's not quite what you need. You can fill out a CAB census. That's available in the second paragraph under NCAB. And you can fill that out at any stage. If you'd like to develop a CAB, if you have a CAB and you're struggling, if you have a cab and you're doing really well and want to share your success, or if you have a cab that's kind of floundering, please submit that, any of those scenarios, so that we can have an accurate census of all the cabs that we have around the country and can stay in touch. You can also document your Homeless Persons Memorial Day events. We'd like to hear from our consumers if possible, but if not, at least our project representatives, to hear how the Homeless Person Memorial Day events went, and then document those for posterity. And then other cabs, we like to, as we said, as Kristin was saying before, we like for the cabs to connect to each other. So you can do that by emailing ncab@nhchc.org, or you can call me, Katie, at 615-226-2292 and tell me more about your cab, and we can be in touch with you better. Thank you for joining the Consumer Involvement and Governance webinar produced by the National Healthcare for the Homeless Council. Please visit the National Council website for a listing of upcoming council webinars and other educational products. Thank you again, Winona and Kristin, and thank you, participants. This meeting will now be closed.